Welcome learners to this program on artificial respiration and chest compression for accident victims. The elementary part will be covered in this. To introduce the topic, at your workplace you may encounter a variety of situations where electricity could be a cause of injury or accidents and emergencies like electric shock, electrocution and so on. In order to save life, you need to be well versed with the process of CPR so that you can help the victim and save his or her life. So what is CPR? CPR or cardiopulmonary resuscitation is the basic procedure that can save a life during emergencies. CPR, what it means? It is made up of three words, CPR. C stands for cardio, that is heart and its functions. P stands for pulmonary, which means the lungs and its function, and resuscitation, that is R, stands for reviving the victim or simply bringing him back to consciousness and decreasing the chances of dying. As you can see, CPR involves all these organs. It helps to revive or bring back the functioning of a human being by acting on the heart and the lungs. What is the definition of CPR? CPR or cardiopulmonary resuscitation is the method by which we maintain the route of breathing, that is the airway, and the heart circulation so that oxygen-rich blood can circulate to the various vital organs of our body like brain and the heart itself. So what does CPR consist of? CPR consists of chest compressions and it consists of artificial, that is mouth-to-mouth, respiration. CPR involves your maintaining of CAB. C stands for circulation, A stands for airway, B stands for breathing. So students, please remember CPR has to be given in form of CAB. That is, you will first attend the circulation, then you will maintain the airway, and then you will go on to give the breathing or maintain the breathing of the victim. So what is the role of CPR? Why is CPR so important? Artificial respiration, which is a part of CPR, also known as mouth-to-mouth breathing, helps to clear the airway and maintain breathing to provide oxygen to the body. Chest compressions will help to maintain the blood circulation so that the oxygen-rich blood can easily go to all the vital organs of the body. These vital organs are brain, which is the most important vital organ of the body. So what are the purposes of CPR? It will help to revive your heart and lung. It will help to provide the life-saving oxygen gas to the brain and other vital organs of the body to maintain the life. It will maintain breathing and maintain and open the airway and clear its route so that your breathing is maintained. It maintains the heart in order to pump oxygen-rich blood to various parts of the body, and it will maintain the victim till any professional help comes. What are the types of CPR? So CPR will depend upon what is the situation. It usually consists of 2 steps, but in certain situations, we may only use 1 step when we give CPR. So, depending on the need and situation, we can modify CPR. For example, what are the types of CPR which are depending on the steps? If we use 2 steps, that is mouth-to-mouth respiration and chest compression, it will involve the full CPR. But if we only use our hands to give chest compression, it is known as hands-only CPR. Usually in certain situations, when a person is reluctant to give mouth-to-mouth respiration, like in cases where you may have a chest infection or your victim may have a chest infection, and even in order to avoid infections during COVID times, hands-on CPR can be used. Types of CPR which is dependent on the number of rescuers. There is one rescuer which is also known as single rescuer CPR. Only one person is there. As you can see, only one person is giving the chest compressions and then he will also give the respiration. Then there are 2 rescuers. Two partners will be there. One will be the leader and other will follow. The leader will give the directions, he can give the chest compressions, and the other person will follow the lead and then give mouth-to-mouth respiration. So what are the conditions when you will use CPR? Since in this case there are electrical injuries, you can first switch off the main source of the current or detach the victim from the electrical line, and then you must check the following. You will shout or call out the name of the victim, but he does not respond. He will not give you any answer. He will not open his eyes. You will check and find that the victim has no breathing and he has no pulse. Then you will go for giving CPR. So, how to do CPR? Firstly, if there is no response, you will check pulse and breathing. If there is no pulse, you will start chest compressions, and then if there is no breathing, you will start mouth-to-mouth respiration. In certain cases, if the victim is not conscious but he has pulse and breathing, you will not give CPR but you will give recovery position. But in the cases the victim is unconscious, he doesn't have a pulse and is also not breathing, you will go for giving CPR. So what is the first step you will do? You will assess the situation, survey the scene and call for medical help. You will see that no electrical injuries are caused to the victim and there is no live wire from which you can also get connected. So please be very careful in such a scene. Immediately call for ambulance or any kind of medical help. Remove the source of electricity from the victim or victim from the source. Always wear insulating articles like rubber gloves or boots before touching the victim if you suspect that electricity is there. Next is you will assess. You will check the response. You will tap the shoulder and you will shout, "Are you okay?" If the victim does not respond, it means that he is unconscious. Next, you will check the pulse of the victim. You can check the pulse of the victim by feeling the pressure of the blood carried in the vessels at the carotid side. Where is the carotid side? Carotid side is located near the upper neck. You will check the airway. You will open the mouth of the victim. How will you do it? See in the picture, the person is using his two hands. He is tilting the head of the victim and he is lifting the chin, and then he is viewing the airway. This is known as head tilt, chin lift method. But in case you suspect that the victim has fallen down, he may have a spinal or a neck injury. Then what will you do? In these cases, you can place the fingers behind the angles of the lower jaw and move the jaw upward. Use thumb to push the chin down. This is known as jaw thrust method. This will open the mouth slightly. In these victims, please do not try to roughly handle the victim because you may have more injuries and give more injuries to the victim. Next, you will clear the airway. You will make a hook of index finger and sweep across the mouth from one side to another in case of unconscious victim. You can create a hook like this and then try to remove any kind of blocks if you can see from one side to another in case of unconscious victim. Then you will check the breathing. Check the breathing by observing the rise of the chest. If there is no rise of the chest, or the victim is gasping, it is taken as no breathing. No longer 10 seconds you will check and then again try to revive the patient or the victim by giving rescue breathing. Then you will start performing the chest compression. So first step is to check and assess. Next is if you find there is no pulse, there is no breathing, start your CPR. The first step is to perform chest compressions. You will position yourself on the side of the victim and then you will locate the area to give the compressions in the center of the chest between the nipples. You will try to make a line from one nipple to another and then choose an area immediately between. This is also the area where the end of the breastbone is there, where the ribs come together. As you can see in the picture, the person has chosen the central area between the two nipples in order to give the chest compression. You will place the heel of one dominant hand over the other and then you will lock the fingers. You will place your dominant hand, the hand which you frequently use. In most of the population, right hand is supposed to be your dominant hand. You will place it and then you will interlock the other hand and then you will perform CPR. Give 30 compressions. Compression should be hard and fast. It should be given 2 inches deeper. Your shoulders must be directly over the sternum and they should not be bowed down like this. They must be stiff when you are giving the CPR. That is compressions. Your elbows should be locked, arms should be stiff, and then you will give the compressions. 30 compressions must be given at a time. Always remember, there should be no movements on your wrists. Your wrist should not unnecessarily move because the kind of pressure you are applying from your shoulders to your wrist, it must be properly utilized to compress the chest. Elbows must be straight. You must have the contact with the chest wall with your eyes and you should not lose that at any time. The rate should be at least 100 to 120 per minute. It should be fast, it should be hard. You should keep on counting 1, 2, 3, 4 and so on till 30 till you give the compressions. Then you must check the pulse every 2 minutes whether you are able to revive the victim or not. Do not lean on the chest, always keep your elbows in a proper manner. Don't interrupt or stop in between your chest compressions. Once you have started the chest compressions, go on with those chest compressions. But you must keep on counting. Then you can alternate 30 with the breathing and then go back to the chest compressions. In case you are attempting hands only chest compressions, you have to keep on giving. Do not compress too hard because you can break the ribs or you can cause a fracture at that point. So you have to press but not too hard. Just appropriate to get the particular cardiac massage that is desired. Last step is to perform mouth-to-mouth breathing. You take a deep breath yourself. You place a barrier like a face mask, handkerchief, chunni or dupatta over the mouth of the victim because you do not want to catch any infection that the victim may be having. So what you will do, you will place something over the mouth like any barrier of your choice. You will encircle the mouth of the victim totally by making a tight seal. You can see the figure, the person has made a tight seal, and you should also pinch the nose of the victim, and on the same hand you should also keep on checking whether your breathing is causing any increase or rise in the chest of the victim to find out whether your rescue breathing is working or not. Blow the air into the mouth of the victim for 1 second and check the rise of the chest. If you cannot see the chest rise, position yourself again. Take a deep breath yourself and then blow the air into the mouth of the victim and keep observing the rise of the chest. Always remember, if the chest rise is not seen, the mouth-to-mouth respiration is not effective. It could be due to the lack of proper mouth-to-mouth seal that is to be made, or the breaths given are not enough, or they are not so forceful that is required, or the airway is not working, it may be blocked. You have to be careful that the airway is not blocked, and then you must utilize all your force in order to give rescue breathing, that is mouth-to-mouth respiration. Always pinch the nose of the victim in order to maintain a seal and avoid air from escaping from the nose. Give one breath every 6 seconds, that is 10 to 12 breaths per minute. Take a deep breath before giving these breathings and in between the two breathing you are giving. Each breathing should be given over 1 second for adults. Place the barrier, handkerchief, chunni or dupatta over the mouth of the victim to avoid cross-infection. So, if there are two people, how this can be done? Act as a leader for assessment. Place the hands for compression. Start compressions and count to 30. So, the number of chest compressions that you have to give, whether one person is there or 2 people are there is always 30. Then the rescuer 1 will count mouth to mouth breathing. This has to be given 2 times. So any person is there, if one rescuer is there or 2 people are helping one another, breathing or mouth to mouth respiration must always be given 2 times. Both the person should switch their roles after every 2 minutes or 5 cycles to avoid getting tired. So your chest compressions must always be 30, after which you will give the mouth to mouth breathing, which is given 2 times. So always maintain a ratio of 30 chest compressions to 2 mouth breathings. So with this, CPR will continue as a cycle. 5 cycle will mean 30:2 is 1 cycle. Second cycle 30:2. Third cycle 30:2 and so on. So this is the way you will alternate chest compressions and the mouth to mouth breathing in order to provide for the various cycles of CPR. When the CPR is effective, does the chest rise and fall with rescue breathing? Yes, it is. It means your CPR is effective. Always check for the chest rise and fall in case of rescue breathing. Has the second rescuer checked the pulse? Is the pulse working? Is the pulse beating? Yes, the pulse is beating when you give the compressions. CPR is effective. So you have to check both these things, chest rise and fall, and if the pulse has come back. Until and unless these 2 things are not there, CPR is not effective. So you have to continue till the medical help arises or arrives for your help. When can I stop CPR? I am continuously giving CPR. When should I stop CPR? When the victim revives. The victim becomes conscious, he starts coughing or his eyes open, your victim has come back to consciousness, your victim has revived. When some trained help arrives, what does it mean? It means when some ambulance comes or your paramedics, doctors and nurses have arrived to take the victim away to the hospital. When you are too exhausted to continue, you have given 5 cycles continuously, but your victim is not reviving, he's not talking to you, and you become too exhausted to continue. At that time, you can stop, but you can give your work to some other person at that moment who is trained in CPR. So you actually do not have to leave the victim there. You can give your work to another person by which he can simply give the hands only CPR. If the scene becomes unsafe, what does it mean? Suppose you're giving the CPR to your victim, but your live wires become jumping, or you sense that you are unable to save the victim, and on top of that your life may also become in danger. You may actually can drag the victim at that time away in case you find the scene has become unsafe. Now, why does a CPR fail? Sometimes you are not able to help the victim. The victim does not come back to his life. So why does a CPR fail in these times? If suppose there is some delay in starting of CPR, always remember, you must continue and you must start early, because brain death can occur within 10 minutes or 4 to 5 minutes it can start. So you should not delay in starting. Improper procedures, like for example, you forgot to pinch the nose properly, your compressions were not fast enough, your breathing was not powerful enough, you were not able to remove anything that may be blocking the victim's airway. So CPR can fail and you may not be able to revive your victim. Victim has some other disease, like for example, he has a heart disease. There is some major cardiac arrest and you're not able to help the victim at that time. At that time, your CPR may fail. If you're afraid to perform CPR, what can you do? You can perform hands-only CPR at that time. Give chest compressions continuously. You can try to open the airway and try to remove if there is any blockage, so that the victim may at least have some kind of air that is circulating. Call for medical help immediately. You should always call for medical help immediately. It is the first and foremost step, after which you can start giving chest compressions and opening the airway and start doing with your CPR. If you start CPR immediately, why it is essential? Always remember, CPR will become more and more effective if you are able to help the victim and start the CPR immediately by having a greater confidence in yourself. There is a better chance of survival if CPR is started immediately. Brain damage can start in 4 to 6 minutes. So, if you do not start CPR immediately, your victim may not get the required oxygen that is there and brain damage may start. Brain damage is certain, that is, it will certainly happen after 10 minutes if you do not give CPR, because your circulation has stopped and your lungs are not able to get the oxygen from outside to give it to the body. So at that time, brain damage can certainly occur within 10 minutes without the CPR. So this is all about the artificial respiration and chest compressions. It is always important to remember 30:2 protocol in case of chest compression and mouth-to-mouth breathing. Always remember, the most important thing in CPR is chest compressions. Your heart has to be revived first. Then you can go for giving mouth-to-mouth respiration. But both are important. If you can give both, very well. But if you feel that cross-infection may be there, you should always try to at least give hands-only CPR. So this is the way CPR works. I hope this video and this lecture may help you in gaining confidence and giving CPR at your workplace, offices, and any other area you are there to help the victim by providing first aid. Thank you so much.